Although often cited for its association health benefits, drinking wine can also have some negative side effects. As alcohol, red wine can have a range of negative effects on the human body when consumed in excessive quantities. Too much alcohol of any kind can lead to higher blood pressure in some individuals, as well as an increased risk of developing certain kinds of cancer, such as those affecting the liver and throat. In this speech, I will explain 5 negative health risks from consuming too much alcohol wine. Secondly, I will reveal some major interactions, wine with medications, that could end up negative. First, sleep deficiency. Many people feel a bit drowsy when consuming wine. This happens because alcohol is not digested but moves directly through the stomach lining and the wall of the small intestine into the bloodstream. Once alcohol gets into the bloodstream, it goes into every cell of the body, depressing cellular activity. But this drowsy feeling is short-lived, and one or more drinks before bedtime can result in a lighter sleep versus your actual good night's sleep. So staying physically active and reducing your alcohol consumption can help you get better sleep. Number 2 is obesity. For some people, one glass of wine can turn into a whole bottle. One 5-ounce glass of dry wine has an average of about 100 calories. And some of the fortified wines and dessert wines containing distilled spirits have even more calories. So while 1 to 2 glasses of wine is about 200 calories or more, how can that fit in your daily caloric goals? Keep in mind that drinking is linked to increased consumption of food and decreased rate of exercise. Number 3, heart disease. According to moderation is important, according to WebMD. Up to 1 drink a day for women and 2 drinks a day for men may provide the associated health benefits, like lowering risk of heart disease. But when drinking habits become higher, you can put yourself at risk of heart disease. Too much alcohol intake can lead to a rise of blood pressure, result in heart failure, or lead to a stroke. For those really interested in a healthy heart, focusing on eating well and exercise has been shown to improve heart health at higher rates than the addition of the glass of wine a day. Number 4, fertility. Although the potential harmful effects of alcohol during pregnancy, such as birth defects or low birth weights, are well known, less well known are the effects on males. For men, excessive alcohol intake can result in lower testosterone levels, slower motility of the sperm and erectile dysfunction. So it is important for both men and women who are attempting to conceive to reduce or even stop their intake of alcohol, period. 5th, pancreatitis, excessive alcohol intake, including wine, can lead to acute pancreatitis. If you already have chronic pancreatitis, it can worsen the symptoms. An article in July 7, 2007, Journal of Pancreatology states, although the association between alcohol consumption and pancreatitis has been recognized for over 100 years, it remains still unclear why some alcoholics develop pancreatitis and some do not. But reducing or abstaining from alcohol may prohibit recurrent acute pancreatitis and reduce the amount of pain caused during chronic pancreatitis. Now, it's time to reveal some of the major interactions caused by wine and medications, the mixing. First of all, narcotic drugs such as Demerol, hydrocodone, morphine, oxycontin, The body breaks down some of the medications for pain to get rid of them. The alcohol in the wine may decrease how quickly the body gets rid of some of the medications for the pain. Taking some medications for pain along with wine might increase the effects and the side effects of some of the medication for the pain. Another one, sedatives. Do not mix. Barbiturates, sedatives. The alcohol in the wine may cause sleepiness and drowsiness. Medications that cause sleepiness and drowsiness are called sedative medications. Taking wine along with those sedative medications might cause too much sleepiness, which isn't good. Antibiotics, that's another one you might want to talk to your doctor about. Be careful with this combination. The alcohol and the wine can interact with some of the antibiotics. This can lead to upset stomach, vomiting, sweating, headaches, and increased heartbeat. So do not drink wine while taking antibiotics. Another one, aspirin. Talk to your health provider because aspirin can sometimes damage the stomach and causes ulcers and bleeding. The alcohol in the wine can also damage the stomach. So taking aspirin along with wine might increase the chance of ulcers and bleeding in your stomach. These were just a few of the medications listed on WebMD. Feel free to look up whatever you might have a question with or call your doctor. Now that I have talked about the harmful effects of wine can cause, explaining the detailed 5 negative health risks from consuming too much wine, and listed some of the interactions caused by mixing wine with a specific medication. I hope that you will do your research if needed and drink responsibly. Thanks and enjoy your holidays.